To Capitol Hill now, where Republican leaders are pushing for a vote on the health care bill. But there's currently not enough support to even bring it to the floor. At least 4 senators say that they will block efforts to begin debate until changes are made to the bill. A nonpartisan analysis estimates that 22 million fewer people will have insurance in 2026 under the Senate bill compared to the current law. Now, the report also expects the bill would cut the deficit by $321 billion over the next decade. For more now, we turn to Politico White House reporter Josh Dawsey to talk a little bit more about this. So Josh, you wrote recently that the White House and Majority Leader Mitch McConnell are working on side deals in order to secure votes that they need to can you explain a little bit more about this? We know that there's a lot of money that has been saved, and you say perhaps some of that money can be used to woo some of these lawmakers into supporting the bill.
Right. Well, you have different lawmakers who want disparate things. You have conservatives who want, more money for health savings accounts. You have moderates who want more money for opioids, want more money for Medicaid. You have to find a way to get all of these members on board. So while they have like $188 billion that they can use from the CVO savings, they're trying to take that money and parlay it into deals where these skeptical members will say, maybe I will support this after all.
Side deals. I thought we were supposed to be doing away with all that sort of stuff. Isn't that part of the swamp behavior?
I think that is a bit of a drain the swamp behavior, but it's not going away anytime soon.
Yeah, really. We know that there are at least 4 Republicans who plan to stop the bill from even coming to the floor. They don't even want to discuss it. So if the procedural vote is canceled or it fails, what happens next?
Well, Mitch McConnell, the Senate Majority Leader, is saying he wants to do it this week no matter. If a vote is canceled, though, that's not possible. And then you go into the July 4th recess next week where lawmakers go back to the district. The problem with that is that, the bill is unpopular, and a lot of these folks are getting protests. They're getting, met at the airports. They're getting lots of feedback saying, we don't want this legislation. So it's hard to imagine they leave for the weekend in a few days and come back more, excited to vote for this. So in some ways, this is becoming a bit of a now or never situation in the Senate. If it doesn't happen this week, it's harder to imagine, it gets easier for them to make these votes.
Yeah, right. They'll be off for the 4th of July, and then after that, they'll be off for another 5 weeks. Sort of the stickiest part of this whole piece of legislation has to do with Medicaid. And nearly 70 million Americans are enrolled in that program, and the CBO says, a number of people will find that they are no longer going to be part of the program anymore, and they will lose their coverage. What does reduced spending mean to those people, the people who get Medicaid?
Well, there's been one of the sticking points of contention. Republicans are saying, we're actually not cutting Medicaid spending. It's going up for what it is right now. Though, under the Affordable Care Act, this would be far different. So they are cutting under what it's currently projected to be. You have reports across the country saying that millions of people would see reduced or they would lose their Medicaid coverage. It's kind of hard to know because we don't know what the particulars of the final legislation will actually be. There's still some sausage making being done behind the scenes.
Right.
But for a lot of these more moderate members, you go home back to a state like Nevada or a state like Michigan or a state, like Florida, and you have, a lot of senior citizens, a lot of older people who reliably vote. And there's some repercussions if you cut people's Medicaid or cut their government services. It's something they actually feel in their pocket, unlike the Russia investigation or some of the other problems that the president and Republicans have right now. These are things that actually affect everyday lives, so it becomes a bit more of a challenge.
Yeah, and the thing about the spending or the slowing down of spending moving forward is, yeah, it's a slowdown of spending, so maybe that's not a cut by some people's definition, but there's also a promise to sort of redefine who can get Medicaid, including many people who are getting it under the Affordable Care Act, who are maybe on the lower income level.
And that was one of President Trump's signature promises on the campaign trail. He would not cut Medicaid. There were a lot of blue-collar workers who, I think were attracted to President Trump because, unlike a lot of the other Republican candidates, he did not make axing entitlements a signature part of his plan on the trail. So, the president has not been super engaged in the minutia of this legislation. He said, he wants this legislation to have quote-unquote heart. He was unhappy with parts of a House bill, but
said it was
some of the
mean.
folks close to the Right. Some of the folks close to the president told me, they're afraid of the repercussions if this does pass. Is there a bigger political damage to be done? If it fails and you say we ran on this for 7 years and we couldn't do anything about it, or if it passes and people start feeling it and then they go, okay, who are we going to blame for this?
Yeah. So Vice President Pence going on a little bit of a charm offensive, if you will, having a dinner party with a few of the Republican senators who are holding out. That's happening tonight. What are the expectations from the White House? What do you think Pence can do? How can he add to this debate?
Well, Pence is seen as a reliably conservative voice. He's seen as someone on the Hill who is trusted, who's well known, who they, enjoy dealing with. He's someone who has credibility on Capitol Hill that sometimes the president doesn't have. But most of his clout is in the House, actually, among conservatives in the House and the members of the House that he, served with for a long time. In the Senate, it's harder to imagine him making a palpable impact. A lot of these senators, cannot be easily swayed like the House members. They're not wooed by fancy dinners at the White House or calls from the president. These are people who've been on Capitol Hill for a long time. They're not necessarily easy to wheel and deal with, maybe like some House members are.
All right. Politico's Josh Dawsey. Thank you so much, Josh.
Thank you.